Good evening, doctors. Welcome to another Simply Nature's Doctors Forum. We want to welcome our existing doctors and also doctors and medical practitioners who are joining us for the very first time. In fact, the response for tonight's webinar is so overwhelming with more than 220 registrants. Hence, we have moved from our regular Zoom meeting platform to a Zoom webinar platform tonight. So please take advantage of the new Q&A tab below, where your questions will be recorded for discussion at tonight's Q&A portion. We are also now able to take live polls, so we can get response from you, the participants, directly. So tonight, we're going to be a bit more interactive than usual. Our topic today, for tonight, is a very important one. The topic is breakthrough for chemotherapy support. Chemotherapy is the most commonly used treatment for cancer. However, it has its detractors because of the side effects. And since our audience tonight is a mixture of conventional doctors like oncologists and integrative doctors like lifestyle medicine practitioners, functional science, orthomolecular, doctors who have strong concerns about chemotherapy. So tonight's topic holds a lot of promise for both the patient and for our doctor's practice, which is your practice. So before we begin, I would like to start with a reconciliatory and positive tone for the night, all right? So let's do that with a poll. And for your information, all the polls that we're doing tonight are all done anonymously. So we will only see the final vote tally, but even us, we won't be able to see the details of the vote. All right? So the first poll, let's try out the polling function. The first poll tonight that we want to do is here. If you are an integrative doctor, would you like to be able to still treat and help a cancer patient who has decided to go for chemotherapy? If you're an oncologist, would you be open to protocols that will allow your patients to better endure the rigors of chemotherapy? So there are two possible answers. If a yes would mean that you would like to help chemo patients, and if you're an oncologist, a yes would mean that you're open to explore how your patients can do better with chemo. The no answer would be you only want to treat patients that are not going through or intend to use chemotherapy. And for an oncologist, if you say no, means you're not interested in mitigating the side effects of chemo. You're comfortable with the current side effects of chemo. All right, so please just take a moment to answer this question. And I hope that thinking about these two options will put all of us in the correct positive state of mind for tonight's discussion. And we will reveal the results of this first poll during the Q&A segment. All right, the objective of today's talk is we have three objectives that we want to achieve tonight. Number one, allow integrative doctors to be able to help more cancer patients by equipping them with the ability to support patients effectively through chemotherapy. So number two, we want to address tonight the primary concern doctors have against chemotherapy. Many naturopaths and integrative doctors have very strong concerns about chemotherapy. However, to be precise, the concern is not really directed at chemotherapy, but actually to the side effects of chemotherapy. Why do I say this? Because I know of many integrative doctors, MDs, who in their normal practice seem to have a surface bias against chemo. But yet they would direct patients or even loved ones who are cancer patients to undertake chemo. So actually this is also the source of tension between many integrative doctors and oncologists. I remember when we had our first doctors forum here in person, we had an oncologist who was a speaker. And I remember the oncologist actually felt intimidated because for once he was now alone in a room of integrative doctors. So there is a tension. And I remember during the Q&A in that first forum, one of the questions was from the integrative doctors was, why do oncologists, differ in opinion so much from us? And how many oncologists are actually open to alternative protocols and perspectives? So again, we really see some tension there. So today, I think we are able to offer a solution which is not only medically beneficial to the patient, but also beneficial to the practice of both oncologists and integrative doctors. So after we address the primary objections against chemotherapy, which is the side effects, we would then naturally be able to get better results from chemotherapy. And so our last and final objective tonight is that we want to help the oncologists who are here tonight, or the conventional doctors who are joining us tonight, to get better results from chemotherapy for their patients. I know these three objectives will be met tonight, and we have a good amount of ground to cover, but I promise you that we will move at a brisk and interesting pace. So let's begin. I want to start by sharing an important fact highlighted by an oncologist that works with SimplyNature. In fact, this is a statement in one of the slides in one of our oncologists' presentations to patients. The slide actually states there very clearly, chemotherapy by itself is rarely able to cure a cancer patient. So I'm sure this brings a lot of relief to the other fields, the integrative doctors, because oncologists know, okay, and there's no argument that chemotherapy by itself alone is rarely able to cure a cancer patient. However, this does not take away from the effectiveness of chemo in killing cancer cells and tumors, but it does highlight that it has limitations. I also want to start by saying something very encouraging, which is I'm very glad to share that there are doctors in SimplyNature whose family members are undergoing chemotherapy, and they are doing very well because they are using our SimplyNature extracts, especially patients on the chemotherapy drug cisplatin. And we will actually focus on cisplatin later in our discussion. All right, so let's start and take a look at the key concern with chemotherapy, and that is actually the side effects. There are less damaging side effects like nausea, fatigue, hair loss, but the one that all of us here tonight in this webinar is foremost concerned with is that chemotherapy damages normal healthy cells. And this is the reason that's most cited, this is the objection that's most cited against the use of chemotherapy. And even patients worry about this. According to the American Cancer Society, the normal cells most likely to be damaged by chemotherapy, and we're talking about in general, regardless of the type of chemotherapy drug we're talking about, right? So the normal cells most likely to be damaged by chemo are blood-forming cells in the bone marrow, cells in the mouth, digestive tract, and reproductive system, and of course, hair follicles, right? Now, we really want to focus on the first one, which is the bone marrow cells, because this poses the greatest challenge to all of us here in tonight's webinar, because it poses the greatest challenge to patient recovery. It also severely limits the effectiveness of protocols used by integrative doctors, those who practice lifestyle medicine, functional science, orthomolecular medicine, and so on and so forth, right? It really, because all these protocols are dependent on a working immune system. So if the immune system is compromised, the protocols are limited in its effectiveness. Now, the bone marrow damage directly impacts the immune system, and that has direct impact on both the treatment of cancer and also the recurrence of cancer. So let's take breast cancer as an example. Many forms of breast cancer can be effectively treated with chemotherapy and other conventional therapies. Some might even say that it is like 100% treatable if detected early. Many forms of breast cancer are so successfully treated nowadays if detected early. However, many breast cancer patients are successful in their first fight, their first bout of breast cancer. But when the breast cancer reoccurs and comes back, it's no longer easily treatable because the cancer has mutated and is now resistant to the very chemotherapy protocols that used to work the first time, right? So when recurrence happens, when the cancer undergoes metastasis, it's really difficult to treat. Now here, and what's the root cause? The root cause is because the immune system is severely compromised because the bone marrow is damaged. Now here is the million-dollar question, and the question that will give our patients hope. What if we can protect the blood-forming bone marrow cells from cytotoxicity damage of chemotherapy? Let me ask that again. What if we can protect the blood-forming bone marrow cells from the cytotoxicity damage of chemotherapy? What would it mean for your protocols for the integrative doctors? Would that allow you to do more with patients that are currently undergoing or finished with their chemotherapy treatments? Will that enable you to more effectively prevent recurrence? Because once the chemotherapy sessions are done, or the oncological surgeries are done, basically it then falls into the integrative doctors in the fields of like lifestyle medicine to continue to support and treat the patient. However, and to prevent recurrence. So if we are able to prevent bone marrow cell damage, would that allow you to give the patient a more complete cancer strategy, both during and post-cancer treatment? Because now you can assure them, the patient, that there is an effective post-cancer treatment plan that will prevent reoccurrence. I hope this gets everyone excited, all right? I hope these questions are exciting you now, and that these are questions that I guess open doors in your practice. So let's take a look at the good news. All right, take a look at the slide that is being shown on the screen right now. Okay, this was a study published in January 25th, 2020. That's this year, right before the ECQ and GCQ, right? So this was published this year, 2020. And yes, if you read the title, it says, basically it's the scientific name, or rather the generic name, but actually it's actually specifically our extract, okay? Our extract prevents cisplatin-induced myelotoxicity in vitro and in vivo, okay? So yes, we have actually tested SimplyNature liquid extracts with chemotherapy drugs. Yeah, right, we actually tested with chemotherapy drug. And we tested it with one of the most common chemotherapy drug on the market, which is cisplatin. Why do we choose cisplatin? Because number one, cisplatin is used for the treatment of at least 12 different types of cancer, from testicular cancer, ovarian cancer, cervical cancer, breast cancer, bladder cancer, head and neck cancer, esophageal cancer, lung cancer, brain tumors, neuroblastoma, colon colorectal cancer. So yeah, it's being used by at least 12 cancer. That also means that this cisplatin is being used for the treatment of the most common cancers today. And that is lung and prostate and colon cancer for males. And for females, is breast cancer, colorectal, and lung. So we chose cisplatin as the drug to use and test together with SimplyNature liquid extracts. And now, here's the exciting results that was published in January 2020 this year. Take a look at the diagram, take a look at the pictures right now. We know that chemo damages bone marrow cells. So let's take a look at the results. The top control diagram, A and B and E, all right, is basically the bone marrow cell. The middle picture is that of cisplatin being applied to bone marrow cells. So you can notice in diagram C and F, you can notice the damage and the fragmentation in the picture. You compare C to B and F to E on top, all right, you can see that the damage and the difference between a normal bone marrow cell and a bone marrow cell that's exposed to cisplatin chemotherapy drug. Now, the bottom two pictures, D and G, This is the bone marrow exposed to cisplatin and our liquid extract together. So it's like a co-treatment, right? Now you can see how the liquid extract has protected the bone marrow from cisplatin cytotoxicity damage. In fact, if you compare the diagrams D and B and G and E, it's almost identical, which implies and which means that the bone marrow is almost completely intact, same as the control, even though it was exposed to chemotherapy drug cisplatin. That's because it was also exposed to liquid extract, our SimplyNature liquid extract. All right, so now let's go to the next slide. For those of us in this webinar tonight that enjoy a bit more technical information, this is actually the molecular mechanism of the SimplyNature liquid extract on how it protects the bone marrow. Okay, basically, I'll just leave the slide on for those doctors who are more technically inclined, who enjoy looking at technical data. All right, just take a look at this. But basically, our liquid extract is able to preserve mitochondrial mass, reduce cytochrome C release, and PARP activation. Consequently, what it does is that it actually promotes cell survival of the bone marrow. Okay, isn't that exciting? Isn't that the good news that we have for our patients? And the great news does not stop at the bone marrow. Let's take a look at another set of 6 pictures, all right? Even the spleen, this is the picture of the spleen. And we all know the spleen is another very crucial organ in the immune system. It's where our immune cells are stored before they are released, right? Even the spleen is protected, as can be seen by the control on the left, and the co-treatment, which is cisplatin and our SimplyNature liquid extract on the extreme right. So you can see the coloration indicators of how the liquid extract has prevented the spleen from being damaged. So it stays more reddish brown than the purple color that you see in the middle, which is cisplatin affecting the spleen, right? So both the bone marrow and the spleen are critical organs for the health and functioning of the immune system. And I'm sure we can all see the implication and what this means. So you can now confidently treat cancer patients who are planning to or currently undergoing chemotherapy. As mentioned, we have doctors with family members taking highest doses of cisplatin. And they're doing well with their chemo cycles because they started with our liquid extract and tablets at the same time as their chemo. And now they are maintaining it through the later cycles of the chemotherapy with a combination of our soft gel capsules and our tablets. And you know, to really highlight this, we're gonna talk about Dominic. I think our existing doctors should be very familiar with Dominic because we have talked about his amazing and wonderful story, his wonderful case study many times. Look at this first picture. This first picture is Dominic on the first day of his chemotherapy. You can see this is before. This is actually before chemotherapy. Just take a look at his arms. Look at the swell in his lymph nodes. Right? So Dominic actually has 3rd stage nose cancer for doctors who are new to us. And he was already so weak even before chemotherapy. Imagine in this condition, what will happen to him as he goes through chemotherapy. Thankfully, he actually took 1 vial of our liquid extract in the morning right before his chemotherapy. And after the chemotherapy, he took 1 vial a day, every day. All right? And let's flash the second picture. Look at this amazing second picture. This is Dominic 1 week after his first chemo session. Isn't it amazing? Have you ever seen a patient look better after chemotherapy? If there is any other better endorsement that chemotherapy actually works, I don't think I can find a better one, right? Have you seen a patient look better after chemo? Well, Dominic is. And let's take a look at the third picture. This is Dominic after more than 38. Yes, 38 sessions of chemotherapy and radiation therapy. Dominic is a success. As doctors, I'm sure you're well aware that child cancer, pediatric cancer is the treatment is a lot more taxing than even adult. You know, most adults just go through 12 sessions, but Dominic, a 4-year-old, had to go through 38, more than 38, if I'm not wrong, total of 42, combination of chemo and radiation therapy. But look at him. Look at this third picture. Even though his hair is, they had to shave him, all right? But look at the color of his skin and look at the plumpness of his cheek. He definitely does not look like a patient who underwent more than 38 sessions of chemotherapy and radiation. And today, let's take a look at today. Today, Dominic's hair has grown back. That's him celebrating his sister's birthday, actually, at McDonald's, all right? In fact, Dominic's mom, Sheila, has joined Simply Nature because of the amazing recovery that Dominic has made. And in fact, Sheila is the wonderful host that introduced our director, Miss Germaine. So she was the first person you saw in tonight's webinar. And that is Dominic's mom. That is Dominic's mom. So this Dominic is a case that is very real and very close to us as a company. Now, I'm sure many patients that will be coming to you will not be going through 38 sessions of chemotherapy, right? But if Dominic was protected, and you can see how he recovered, and today he's turning 6 years old soon. I think at the end of this year, he'll be 6. When I first saw him, he was 4 years old. He's doing well. If Dominic can do well with 38 sessions of chemotherapy, imagine what our liquid extracts and our extracts can do for your patients who are only going for 8 sessions or 12 sessions. Exciting, right? Wow. Let's just take a break for a moment and let this data, this presentation, what I've shown you sink in. And meanwhile, let's take another poll to help us focus our thoughts, all right? So currently, how many of your cancer patients are actually going through chemotherapy or have gone through chemotherapy? The options are less than 25%, 25%, 50%, more than 50%. Take a quick, just give a rough estimate and key in your vote. And we'll tally, and it'll be interesting to find out in a room of so many doctors, what is the data? Well, if your answer is less than 25%, imagine the growth opportunity for your clinic and your practice. Because now you can engage patients which you previously would not want to engage or were limited in being able to engage, which is patients undergoing chemotherapy. So now you can actually engage patients undergoing chemotherapy, because instead of offering an alternative to chemo, you can actually offer them treatment and support to go through chemo, protecting their bone marrow, so that after they have finished their cancer protocol with their oncologist, when they come back to you for lifestyle, for rebuilding up of the immune system, your protocols will actually give them great results because their bone marrow, their spleen are all protected. If your answer is more than 50%, that means you are already in that field. So imagine this powerful tool that we're going to add to your repertoire that you can do for your patients. All right. Okay. Are we ready to continue? Just a few more breakthrough information, right? And then we will move on to our Q&A. So let's go. Chemo drugs like cisplatin do more than damage bone marrow and spleen. In fact, cisplatin is one of the most imitogenic chemotherapy agents. So it severely causes nausea and of course, loss of appetite. But here in this slide, you can see with co-treatment of our liquid extract helps the patient maintain their weight. That's the green line compared to the pink line, where you see a loss of 10% of body weight in a short 4 days. You can see Dominic, again, when you take a look at Dominic's picture, you can see Dominic actually gained weight after starting chemotherapy. So that's, again, our product does more than just protect the bone marrow and the spleen. It also counteracts the other side effects. And here's another very important side effect that cancer patients go through, and how we will bring them so much relief. When we think about Dominic, a 4-year-old going through chemo, we shudder at the pain that he's going through. In fact, chemotherapy-induced neuropathic pain, CINP, is one of the most severe side effects of anti-cancer agents, such as platinum and taxanes-derived drugs, and that actually includes our oxaliplatin, cisplatin, carboplatin, and paclitaxel. All right. Now, take a look at this research review that I'm just posting on screen right now. It basically shows that pharmaceutical treatment of chemotherapy-induced neuropathic pain, PPAR gamma agonist, is a promising tool, right? In fact, this review was published last year in August 2019, and it shows that ppar's gamma agonist is a promising pathway for the management and treatment of neuropathic pain. For the doctors who are new to Simply Nature, if this is your first time you are encountering us in this webinar, our products contain natural PPARs, alpha and gamma agonists. So we actually contain a natural form of the PPAR agonist that can be used for management and treatment of neuropathic pain, according to the review. So our series of products that we are discussing today is actually the Simply Nature PPAR range. So back to the neuropathic pain, safe and effective therapies to prevent or treat CINP are still unmet. It's still an unmet clinical need. So again, we have a solution here in our product range and our Simply Nature PPARs range that show promise that we can actually alleviate or help our patients with this, with the pain. Now, apart from pain, I'm going to finish up pretty soon. Apart from pain, other long-term side effects which happen when chemo causes long-term damage to the following organs: heart, lungs, kidneys, and reproductive organs, and also the liver, actually. Now we go back to cisplatin. For cisplatin, nephrotoxicity is actually a major concern, and it will actually affect the dosing of cisplatin. So again, we go back, bringing us back to our final segment, which is about lungs, kidneys, and liver damage. These are organs that, though specialists like oncologists, like our oncologists that join us tonight, they are very aware of the possible damage to these organs through chemotherapy. However, it's not in their specialized area of care. And for the many integrative doctors here tonight, this is an area in which you are keenly concerned. Why? Because the cancer patient is already under a lot of stress from chemotherapy. It is preferable to manage the heart, lung, kidney, and liver damage without further burden of drug loads. So to put it simply, if we can manage the health of the lung, kidney, and liver, and the damage that comes from chemotherapy to these organs, if we can deal with it without more drugs, it will be best for the patient, because it will not put any additional stress on these very organs itself, and so a natural solution would actually be ideal. Okay. And in our previous doctor forums, we have already looked into all the benefits and the effectiveness of our Simply Nature PPAR series on kidney, liver, heart, and heart health, right? And immune system. And in fact, just last month, our entire forum was about lungs and how our Simply Nature PPARs is able to reduce bronchial mucus secretion and alveolar infiltration. So I'm just going to flash this slide. This was from our last doctors forum. So we talked about how we prevented basically infection of the lungs, inflammation of the lungs, mucus production, secretion in the lungs, and this had a lot of bearing to the current COVID-19 pandemic, especially here in Philippines. So how this actually works for the benefit of our new doctors is actually that our extracts are actually gene activators, and it activates the particular pathways that control immune response, anti-inflammatory response, metabolic pathways, and cell delineation, which in turn affects the immune system, helps to manage blood sugar levels, blood cholesterol levels. Now, all immune system, blood sugar level, blood cholesterol level, all these are actually critical to the health and proper functioning of the heart, the lungs, the kidney, and the liver. So the organs, they are also stressed, and these are the organs that are also stressed by chemo, not just the bone marrow and spleen. So what we have in the Simply Nature PPAR series is not just protection against cytotoxicity from chemotherapy drugs, but we also help to manage the patient's blood sugar, cholesterol, reduce inflammation throughout the body, and help doctors like yourself take care of the other organs and system, which actually defines your holistic approach to supporting and treating cancer. This is actually the primary function and benefit of our PPAR Plus tablets, managing the blood cholesterol, blood sugar, the general inflammation levels, right? And that's why extracts and tablet combination is the best protocol for cancer patients, especially if they are undergoing or have undergone chemotherapy. And not only that, a lot of our doctors here actually work with RGCC for diagnostics, and I'm sure you're familiar with their high-end onconomics diagnostics, right? So here is actually, we actually have an RGCC report of a Filipino patient who gave us permission, along together with her doctor, gave us permission to just share, not to post on Facebook, but just to share in discussions like what we're having tonight. All right. So I'm just going to quickly flash it up. Please respect the privacy of the doctor and the patient, even though they have given us permission to show this. Yeah. So this is just to show that actually RGCC onconomics test actually found that our Simply Nature PPARs actually worked to induce cancer cell apoptosis. So there again, it has all these benefits for cancer patients. So we've covered a lot tonight. I just want to end on the RGCC note because it is a diagnostic test for a Filipino cancer patient here in Philippines, done by a Filipino doctor. So that's just another evidence to show the progress that we've been having in the last few years in treating cancer patients and supporting cancer patients through chemotherapy in Philippines. Now, I'm sure all the doctors and medical practitioners here tonight have lots of questions, all right? I expect many questions will be about protocols, dosages, specific types of product, whether the powder extract or the liquid or the soft gel. So I would like to end my structured discussion here so that we can really move into the Q&A session, and you can ask these questions, and I expect questions along these lines. And so thank you for your attention for the past, 30 minutes or so. And I look forward to the questions that you will have, and our panelists will be here to answer them. All right, let's move to the Q&A.